In the ever-changing world of medicine, we find that primary care is seen more and more each day as the heartbeat of healthcare. Today, we're diving headfirst into the world of primary care, a realm where compassion, expertise, and genuine patient connections intertwine to shape a healthier and happier society. When it comes to primary care, the belief is that health is not just about treating symptoms, it's about understanding the whole person, their lifestyle, their hopes, their dreams. Today, we'll be exploring the essential aspects of primary care with the help of our esteemed guests, two passionate primary care physicians with their fingers on the pulse of preventative care, health education, and disease management. This is You and Your Health.
Doctors Hospital has reimagined primary care. We have invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations across New Providence, Grand Bahama, and Exuma, we invite you to experience the Doctors Hospital difference. Book your next appointment at clinics.doctorshos.com.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now.
Go to doctors.
3 advanced facilities at Collins Avenue, Carmichael Road, and Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
You and Your Health is brought to you by Doctors Hospital Health System.
Welcome to You and Your Health, everyone. I'm your guest host, Alexis Burrows, Marketing Director at Doctors Hospital. Here with me to talk about primary care today is one of Doctors Hospital's primary care physicians, Dr. Vashti Darling. Welcome to the show, Dr. Darling.
Thank you for having me.
So, as the world has moved more into a post-COVID environment, we are seeing an increased spotlight and importance placed on the role of primary care in health systems across the world. Before we dive into that, though, let's start at the beginning. What is primary care, and what is its role in the health system?
So primary care is your entry point to health.
Okay.
Primary care is where we greet the patient and find out their previous medical history, find out what it is, what concerns that they may have. It's the foundation of healthcare. It's what we build our healthcare system upon, and it's the most vital component of any healthcare system across any country.
Okay, so essentially it's the gateway into the broader spectrum of care.
Precisely.
Okay. So what are some of the key components of primary care, and how do they contribute to the overall well-being of patients?
When we talk about primary care, we can categorize it into 3 key components. The first being prevention, the second being health promotion, and the third being continuity of care.
Okay.
When we talk about health promotion, our goal is to do just that. Educate the patient, make them aware of the do's and don'ts of a healthy lifestyle. Continuity of care, on the other hand, refers to creating a relationship with the patient, building a rapport such that that patient is willing and wanting to come to you for further services. And most importantly, health prevention. That's preventing chronic illnesses such as diabetes, heart disease, as well as hypertension, obesity. And by doing this, we prevent their need for tertiary care in the future.
Right. So you mentioned earlier that primary care is considered the foundation of a strong healthcare system. Can you explain why that is?
Well, in any healthcare system, you have various levels. And just as the saying goes, the wise man built his house upon the rock. Primary care is that rock. Once you have a stable foundation, of course, that would lead to a more firm structure. So primary care is that, as we said earlier, the gateway into healthcare.
Okay. So in your day-to-day approach as a physician, because you've mentioned preventative care being a key component of this, how do you prioritize preventative care with your patients?
So in order to prevent something, you have to know what it is you're preventing and how to prevent it. So my primary concern would be educating the patient. Education is power, knowledge is power, and in order to be aware of what it is that you should and shouldn't do, you have to first know about it. So we spend a great deal of time educating patients during their consultation.
Okay. And then you mentioned earlier too that it prevents people potentially from having to go into tertiary care. So can you just explain the difference between primary care and tertiary or specialized care, and what advantage does having a primary care physician offer patients?
So at the level of primary care, we're equipped to see and deal with many different medical conditions. And very often it's said primary care specialists are jacks of all trades. What that gives us the advantage to do is to network with specialty services and act as a liaison between the patient and the specialty service, thereby helping them to navigate into an area that they need further attention or further management.
Okay. So basically, if I'm coming to you as my primary care physician and you notice something that, you know, requires a specialist, you can then kind of guide me in that direction to say, hey, you probably need to see this particular type of physician in order to take your care into that next level if it requires that sort of, I guess, extended care.
Exactly.
Okay.
Yes, sir.
Makes a lot of sense. So Dr. Darling, we have to take a quick break, but we have a lot more to talk about. You're watching You and Your Health. We'll be right back.
Doctors Hospital has reimagined primary care. We have invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations across New Providence, Grand Bahama, and Exuma, we invite you to experience the Doctors Hospital difference. Book your next appointment at clinics.doctorshos.com.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now.
Go to doctors.
3 advanced facilities at Collins Avenue, Carmichael Road, and Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome back to You and Your Health. If you're just tuning in, I'm Alexis Burrows, Marketing Director at Doctors Hospital, and today's guest host. On today's show, we are talking about primary care with Doctors Hospital's primary care team. Joining our discussion now is Dr. Rodlyn Malcolm. Welcome to the show, Dr. Malcolm.
Thank you for having me.
So before the break, we discussed primary care from a bird's eye view. But as we consider the season that we're in, I'd like to ask you both a few questions about preparing for back to school. So Dr. Darling, we'll start with you. What are the most common health concerns you encounter as students prepare to return to school?
So as students prepare to return to school, they essentially come in for what we call a physical or school health examination. At that time, we're able to hone in on deficiencies. So in some instances, we can determine whether or not they're deficient of certain nutrition or nutrients rather. Also, we're able to detect if there are any issues with vision, hearing, and it gives us an opportunity to address those concerns at that time.
Okay. So, Dr. Malcolm, how can parents best prepare their children for a healthy transition back to school? I mean, this is especially considering summer can be a wild and crazy time. You tend to eat a little bit worse, you tend to stay up a little bit later, maybe watch a little bit too much TV, that sort of thing. So from your perspective, how do you prepare, or how can parents best prepare their children for that transition?
And as you said correctly, the back to school season is a crucial time for both parents and children. And so it really all lies in preparation. And preparation can be physical preparation as well as mental and emotional preparation. So physical preparation specifically, as you mentioned, doing the school physical examinations, making sure that vaccinations are up to date, addressing health concerns is also very important. Other things that we should be cognizant of is timing, knowing when to get our supplies, having a good discussion and rapport with the teachers to know what it is that our children need at the point of entry into school. Also, along with that, we have to be prepared. And being prepared meaning that maybe a 1 week or two before school starts, our kids should have a bedtime. Set an alarm, try to get up the same time every morning, get dressed as if you're doing a play, trying to be prepared for school as if it's actually happening, to get them prepared, things like that. Again, we also want to make sure encourage limiting screen time as well, to help with sleep preparedness, to make sure that we are well rested, our kids are well rested to be prepared for school. And not only physical, remember mental and emotional too. Going back to school can be very anxiety triggering for a lot of kids. So we want to encourage a safe space for discussion to talk about what are their expectations for the school semester, what is it that they can do to help to improve their feelings about school and to make them feel a lot more confident knowing that school is the place for them and they could have a discussion with you.
So he will normally say they're asking for a friend, but I'm asking for me because I have a 5-year-old that I have to get ready to get back into the mindset of school very soon. So thank you for that. Dr. Darling, what strategies do you recommend for helping students cope with the stresses of a new school year? Dr. Malcolm mentioned that, that's one of the things that people have to be aware of. So what are some things that you can recommend?
So organization is key, and be it a very young child who's in primary school or your older child who's in high school, you want to get them into the routine of doing things. If you operate using a schedule or a timetable, you want to get the child in that habit of routinely doing their homework after school, routinely going to bed by a certain time, routinely helping with the chores such that they're prepared, and on a daily basis they know that, okay, at such and such a time this is what I have to do. So that's number one for organization. Number two, like Dr. Malcolm said, over the summer, it's a very different environment. You're able to enjoy the pleasures of being outside, enjoying games, using the tablet, the computer, etc. You want to put a stop to that during the school year, such that it's a limited amount of screen time for kids. In this current era of technology, students in particular, yes, we are just out of the pandemic and virtual learning has played a crucial role on the education system, but you want to differentiate between recreational time as well as educational time.
Okay, sounds good. Dr. Malcolm, how can parents encourage regular physical activity for their students as schedules get busy? And I think this is a question especially for high school students where the workload can be fairly intense and you might have extracurriculars. So what advice can you give parents in that situation?
To encourage physical activity? Well, we want the best for our kids. And the best meaning encouraging physical activity as best as possible. And sometimes we hate to admit it, but we really have to lead by example. So an active parent, guardian equals an active child. And how we can do this is by encouraging our kids. There are after-school programs in the community, things like that they can do that could help to foster that physical activity more often. Other things that we can encourage is actually participating, being there with our kids, helping to purchase equipment that they need, modeling that same behavior. And a lot of evidence have shown that having active parents increases the likelihood of you having an active child by 6 times, and that's a significant amount. So having both active mother, father, or guardians can increase the likelihood of your child being active. Again, activity helps to increase and promote excellent academic performance, as well as improving your mood and emotion and helping to regulate a lot of those things. So physical activity starts with us. Our kids will model that behavior once they see us being an example.
Right, I think you touched on it. It is true that physical activity is a good outlet for some of those stressors that we're talking about as well, right?
Yes,
okay.
Absolutely.
All right, so Dr. Darling, what can parents or students expect from a school physical, and who typically needs one? Because I remember, I think I was like primary school, high school, and then college, like at the start. But,
Right.
you know, is that still what it is?
So ideally, just as adults get annual physicals on a yearly basis, the same should apply to children. However, what we often find is that when children receive their immunizations at age 4 to 5, and then there's a break in between until age 10, during that 4 to 6 year period, very often the child is not seen for whatever reason. So the school physical is an opportunity to bring the child in. So I would encourage annual physicals for children of all ages. As far as the school physical goes, usually schools are asking parents to bring in their children at least at the start of a new school year. Okay, that would be if they're entering a new school, or if they're transitioning from primary school to high school, or from junior high to senior high. But ideally, this should be done annually.
Okay. So, Dr. Darling, I know one of the key questions parents may have, and that we have as a general issue, is the idea of nutrition, especially when kids go to school and they have the ability to get their own lunch, that sort of thing. So what advice could you give parents to aid their students in having a healthier, school experience when it comes to what they eat?
So packed lunches are still encouraged, strongly encouraged. And that way, as a parent, you have full control over what it is you purchase for your child to eat. And a packed lunch would consist of a balanced, healthy meal, whether it be a healthy snack such as fruits. If the child is going to have juice, it should be 100% juice. Definitely water, of course, and then perhaps a sandwich. When we get into the realm of purchasing food, that's when we lose control a bit of what it is the child has the ability to purchase. Some schools have regulations in place in terms of offering healthy lunches. However, there's not much control over what it is the child is allowed to purchase. So for me, the rule of thumb is always to encourage a packed lunch.
Okay. So no hot patty and twists and a Coke soda for lunch then?
Precisely.
Gotcha. Throwing shade once again. So I hope you're enjoying this discussion at home as much as I am. We will continue our conversation right after the break. This is You and Your Health. We'll be right back.
Doctors Hospital has reimagined primary care. We have invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations across New Providence, Grand Bahama, and Exuma, we invite you to experience the Doctors Hospital difference. Book your next appointment at clinics.doctorshos.com.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now. 3 advanced facilities at Collins Avenue, Carmichael Road in Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome back to You and Your Health. I'm Alexis Burrows, today's guest host. Our guests, primary care physicians Dr. Vashti Darling and Dr. Rodlyn Malcolm, are still here, and we're wrapping up our discussion on primary care. Accessibility, affordability, and technology in care are 3 of the hallmarks of the Doctors Hospital primary care offering. I'd like to do a deeper dive on these tenets as we conclude our conversation. So with primary care clinics at Dowsville Medical Center, Centerville Medical Center, and Carmichael Medical Center, where you operate out of, Dr. Malcolm, how important is it to make primary care more accessible?
So with accessibility comes great access to health care. So having clinics in various positions on our island makes it easier for our clients, for our Bahamian citizens to be able to come in and access healthcare, address any concerns. So it's important to be able to provide that for our Commonwealth.
Okay. How important is it, Dr. Darling, to have programs like LAMP and NHI, the Doctors Hospital offers, in making primary care more affordable?
It's extremely important. It speaks to the affordability of the service. It gives patients the opportunity to see their primary care physician in a timely fashion without worrying about the costs associated with it.
Okay. And then back to you, Dr. Malcolm, and back to the part about accessibility. What impact does telemedicine and digital health solutions have on accessibility for patients?
Okay, so for example, telemedicine, it allows clients to access healthcare without being physically present in the environment at the same time. So if I want to see and have a consult with a patient in Exuma, okay, where we have one of our other locations, then I could be able to give that patient the care and access that they need to health without being physically present. Because as we know, sometimes there are restraints to travel. Not everybody has access to healthcare or can travel based on a disability or something that's happening. So at least we can provide that opportunity technology-wise to give them the access, give them advice, even give medical professionals in the environment with them some advice on how to take care of them appropriately.
Right. Dr. Darling, why is collaboration between primary care and specialist physicians critical in patient care?
So depending on what it is you're referring a patient for, you need that direct communication with that specialist. You having a relationship with a primary care provider gives you that opportunity. I can get on the phone with one of my colleagues, discuss a case, and in minutes have the ability to guide that patient in a particular direction based on what it is that specialist offers or what that specialist suggests from a medical standpoint.
Okay, and I know we talked about this earlier, but I think it's important that we kind of end wrapping back around to the conversation about education. So, Dr. Malcolm, what role does education play in primary care, and especially in the arena of patient empowerment?
Again, we always say knowledge is power, knowledge is key. And with primary care, again, we focus on a communication-based network with our patients. We want to have a good relationship with our client, and with a good relationship comes that freedom to discuss issues. Once you have that relationship, it's easy. You could educate your patient. They are more receptive to the information that you give them. And once that happens, they become a little bit more confident in asking questions and being more knowledgeable about their health. And so when you have that happening, you get more questions, you get more knowledge, and it empowers the patient to do more about their health.
I guess essentially it helps them to take control of their own health as well.
Yes,
right,
sir.
which is critical. All right, this has been an amazing show. I want to thank both Dr. Darling and Dr. Malcolm for coming on. It's been a great conversation. Thank you both.
Thank you for having us.
Thank you.
If you'd like to book an appointment to see one of our primary care physicians, you can visit clinics.doctorshosp.com. You can also visit any one of our 3 locations in New Providence at Dowdeswell Medical Center, Centerville Medical Center, or Carmichael Medical Center. You can also visit our locations in Grand Bahama, at the Freeport Medical Center in Freeport, and at Cavallo Medical Center in 8 Mile Rock. We also have a clinic in Exuma at the Exuma Medical Center in Georgetown. It has been a pleasure hosting today's show. Don't forget to follow You and Your Money on social media, and tune in next week for another exciting show. Thank you for watching.
Wake up, wake up, wake up dead early with Bahamas at Sunrise on RTV, channel 212. We're live at 6:30 a.m. on Mondays and Fridays with rebroadcast at 8 a.m. on Mondays, Wednesdays, and Fridays, and also at 9 a.m. on Saturdays. Man, Bahamas at Sunrise brings you everything. We got weather, fashion, food, politics, current events, music, and more with your host, Mark Daniels, and Gabriel Gardner. Tune in to Bahamas at Sunrise, dead early, the best in Bahamian morning television.